We are a peaceful people. Struggle is we struggle, and we don't look for trouble. Just ask around. But when outside faces from foreign places talk about taking over, we ain't backing down. We ain't giving up no mountains, we ain't giving up no tree, we ain't giving up no river that belongs to we. Not one blue sake, not one rice grain, not one caress, not a blade of grass. This land is all I know. We gonna make it somehow. We will bend like a bow and never break. Our fathers came here and they lived and died here, and we ain't moving nowhere, make no mistake. Cause we ain't giving up no mountain, we ain't giving up no tree, we ain't giving up no river that belongs to we. Not one blue sake, not one rice grain, not one caress, not a blade of grass. We love the open country of the Rupununi and the Essequibo, the time of night. Though we may criticize it, this is our home, we love it, and we need to keep it. We have that right. So we ain't giving up no mountain, we ain't giving up no tree, we ain't giving up no river that belongs to we. Not one blue sake, not one rice grain, not one caress, not a blade of grass. So we ain't giving up no mountains, we ain't giving up no tree, we ain't giving up no river that belongs to we. Not one blue sake, not one rice grain, not one caress, not a blade of grass. We are a peaceful people. Struggle is we struggle, and we don't look for trouble. Just ask around. But when outside faces from foreign places talk about taking over, we ain't backing down. We ain't giving up no mountains, we ain't giving up no tree, we ain't giving up no river that belongs to we. Not one blue sake, not one rice grain, not one caress, not a blade of grass. This land is all I know. We gonna make it somehow. We will bend like a bow and never break. Our fathers came here and they lived and died here, and we ain't moving nowhere, make no mistake. Cause we ain't giving up no mountain, we ain't giving up no tree, we ain't giving up no river that belongs to we. Not one blue sake, not one rice grain, not one caress, not a blade of grass. We love the open country of the Rupununi and the Essequibo, the time of night. Though we may criticize it, this is our home, we love it, and we need to keep it. We have that right. So we ain't giving up no mountain, we ain't giving up no tree, we ain't giving up no river that belongs to we. Not one blue sake, not one rice grain, not not a blade of grass. So we ain't giving up no mountains, we ain't giving up no tree, we ain't giving up no river that belongs to we. Not one blue sake, not one rice grain, not one chorus, not a blade of grass. We are a peaceful people, struggle is with struggle, and we don't look for trouble, just ask around. But when outside faces from foreign places talk about taking over, we ain't backing down. We ain't giving up no mountains, we ain't giving up no tree, we ain't giving up no river that belongs to we. Not one blue sake, not one rice grain, not one chorus, not a blade of grass. This land is all I know, we gonna make it somehow. We will bend like a bow and never break. Our fathers came here, and they lived and died here, and we ain't moving nowhere, make no mistake. Cause we ain't giving up no mountain, we ain't giving up no tree, we ain't giving up no river that belongs to we. Not one blue sake, not one rice grain, not one chorus, not a blade of grass. We love the open country of the Rupununi and the Essequibo, the time of night. Though we may criticize it, this is our home, we love it, and we need to keep it, we have that right. So we ain't giving up no mountain, we ain't giving up no tree, we ain't giving up no river that belongs to we. Not one blue sake, not one rice grain, not one chorus, not a blade of grass. So we ain't giving up no mountains, we ain't giving up no tree, we ain't giving up no river that belongs to we. Not one blue sake, not one rice grain, not one chorus, not a blade of grass. We are a peaceful people, struggle is with struggle, and we don't look for trouble, just ask around. But when outside faces from foreign places talk about taking over, we ain't backing down. We ain't giving up no mountains, we ain't giving up no tree, we ain't giving up no river that belongs to we. Not one blue sake, not one rice grain, not one chorus, not a blade of grass. This land is all I know, we gonna make it somehow. We will bend like a bow and never break. Our fathers came here, and they lived and died here, and we ain't moving nowhere, make no mistake. Cause we ain't giving up no mountain, we ain't giving up no tree, we ain't giving up no river that belongs to we. Not one blue sake, not one rice grain, not one rice, not a blade of grass. We love the open country of the Rupununi and the Essequibo, bedtime on night. Though we may criticize it, this is our home, we love it, and we need to keep it. We have that right. So we ain't giving up no mountain, we ain't giving up no tree, we ain't giving up no river that belongs to we. Not one blue sake, not one rice grain, not one rice, not a blade of grass. So we ain't giving up no mountains, we ain't giving up no tree, we ain't giving up no river that belongs to we. Not one blue sake, not one rice grain, not one chorus, not a blade of grass. We are a peaceful people, struggle is we struggle, and we don't look for trouble, just ask around. But when outside faces from foreign places talk about taking over, we ain't backing down. We ain't giving up no mountains, we ain't giving up no tree, we ain't giving up no river that belongs to we. Not one blue sake, not one rice grain, not one chorus, not a blade of grass. This land is all I know, we gonna make it somehow. We will bend like a bow and never break. Our fathers came here and they lived and died here, and we ain't moving nowhere, make no mistake. Cause we ain't giving up no mountain, we ain't giving up no tree, we ain't giving up no river that belongs to we. Not one blue sake, not one rice grain, not one rice, not a blade of grass. We love the open country of the Rupununi and the Essequibo, bedtime on night. Though we may criticize it, this is our home, we love it, and we need to keep it. We have that right. So we ain't giving up no mountain, we ain't giving up no tree, we ain't giving up no river that belongs to we. Not one blue sake, not one rice grain, not one chorus, not a blade of grass. So we ain't giving up no mountains, we ain't giving up no tree, we ain't giving up no river that belongs to we. Not one blue sake, not one rice grain, not one chorus, not a blade of grass. We are a peaceful people. Struggle is we struggle, and we don't look for trouble. Just ask around. But when outside faces from foreign places talk about taking over, we ain't backing down. We ain't giving up no mountains, we ain't giving up no tree, we ain't giving up no river that belongs to we. Not one blue sake, not one rice grain, not one caress, not a blade of grass. This land is all I know. We gonna make it somehow. We will bend like a bow and never break. Our fathers came here and they lived and died here, and we ain't moving nowhere. Make no mistake, 'cause we ain't giving up no mountain, we ain't giving up no tree, we ain't giving up no river that belongs to we. Not one blue sake, not one rice grain, not one caress, not a blade of grass. We love the open country of the road.
Honorable members, I declare this 62nd sitting of the National Assembly of the 12th Parliament of the Cooperative Republic of Guyana to be duly constituted and in session. The clerk will lead us in prayers.
Almighty God, we who are here gathered together, do most humbly beseech thee to guide us in all our consultations, so that we may together build a land where knowledge is free, where the mind is without fear, the head is held high, and where words come from the depth of truth. Grant us, O God, thy aid and guidance, so that we may deal justly with the several causes that come before us, laying aside all private interests, prejudices, and personal preferences, so that the result of our counsels may be to the glory of thy blessed name, the maintenance of true religion, the preservation of justice, the safety, honor, and happiness of the President, and the peace and prosperity of Guyana. Grant us, O God, the vision so to lead that all the people of this fair land may enter into that state of brotherhood and unity, where the mind is led forward by thee in the ever-widening thought and action.
Thank you, honorable members. Please be seated.
Messages from the President. Announcements by the Speaker.
Honorable members, we are reviewing a tape provided by the honorable member, Ms. Jurita Finance. There's a team that is reviewing the tape to establish the claims that were made during her presentation.
Presentation of petitions, presentation of papers and reports, etc.
Honorable Senior Minister in the Office of the President with responsibility for finance.
Thank you very much, Mr. Speaker. I rise this morning to present the following papers and reports. One, the value-added tax amendment of Schedule 2, Order 2023, Order number 10 of 2023. Yet another piece of legislation, sir, intended to bring into operation the measures announced in Budget 2023, which we are currently in the process of considering. And secondly, sir, facility agreement dated December 30th, 2022, between the Cooperative Republic of Guyana and the Bank of China Limited for an amount equivalent to 160,852,464 euros, to partially finance the new Demerara River Bridge project. Thank you very much, sir.
Thank you very much, Honorable Minister.
Reports from committees. Oral questions without notice. Questions and notice. Statements by ministers, including policy statements. Personal explanations.
Mr. Speaker,
Honorable Member, Ms. Ferguson.
thank you very much, Mr. Speaker. Mr. Speaker, with your leave, I rise to register my dissatisfaction, displeasure, and disappointment in the behavior of some members in the House. What?
Just 1 second, Honorable Member. Honorable members, I just want to say for refresher purposes that there is an established procedure. If persons want to uh, stand and make a presentation on the sum of these heads, leave must be given by the speaker. And there is a time frame that we have established. It is practice that the leave come within a certain time frame so that we can hear what is being said. The parliament is not a place where we just stand and say what we want to say. There are established rules and procedure that we have to follow. And I intend to ensure that we will keep the rules and the orders that are on the books. Honorable member, let me hear you now. Go ahead. So I wouldn't give leave on the floor to people just like that. Go ahead.
Okay, thank you very much, Mr. Speaker. As I said before, I rise to register my dissatisfaction, displeasure, and disappointment in the behavior of some members in the House. Sir, while I understand that heckling is allowed, it can be done in a respectful and decent way. On Monday last, our very own Dr. Letitia Wright visited the National Assembly, and during her brief address, she admonished us to be peaceful and exhibit love to each other. We are considering the estimates, and in our presence, we have professionals from public service. Online, we have the entire globe watching and listening to us. And members' behavior can only be described as ludicrous and distasteful. This morning, we have present amongst us young people, future of tomorrow. Opposition members on this side of the House have endured verbal abuse,
Honorable
untruths.
member, I think you have made the point. That is, you would like to see behavior conducive to the National Assembly and an example to the nation. Thank you very much at
No,
this point.
but Mr.
Thank you very much. Thank you very much.
So therefore,
Honorable
you can, I cannot continue.
You've made the point. Thank you very
Well,
much.
I will make it on social media.
Please do. I think that is the kind of behavior you've actually asked us to observe. And before we, Honorable Member, Mr.
Thank you. Thank you very much,
Jones.
Comrade Speaker. On the same note of personal explanation, you mentioned earlier about the videotape that is going to be reviewed. The Honorable Member, Ms. Dorita Fernandez, have since withdrawn the statement and issue an apology to the Minister of Education, Ms. Priya Manikchan.
Thank you very much, Honorable Member. Honorable Member, Ms. Ferguson, no, not to raise, it's working. What you've just observed seems to be working. All sides. I think before we continue, I must Apologize to Camille Institute and the students. I am. There's a teacher here with Camille Institute. I think we'll have two sets of students. 30, I think, for the first hour, and then another 30. Um, Camille is from my alma mater, also Charlestown Government School, and she always wanted to be an educator. So thanks for coming to the Camille Institute, Susdike. As we're on the uh, making a few announcements, I forgot to mention we have lost one of our brilliant, not to death, but another job, young professionals who have kept the live streaming going excellent with the software, Mr. Alonso Scipio. We have lost him to CARICOM. He's now the Assistant Public Relations Officer of CARICOM. And so we want to wish him well. And I wanted to put that on record. He's done extremely well. At least I can vouch for the 2 years I've been here. Good luck, Mr. Scipio.
Request for leave to move the adjournment of the National Assembly on definite matters of urgent public importance. Motions relating to the business or sittings of the National Assembly and moved by a minister. Introduction of bills. Public business. Government's business.
Honorable members, we will now resolve ourselves into Committee of Supply to consider the estimates. The next agency up is the Ministry of Health. Mr. Mahipal, be careful how you're using some. In South India, that particular Devata is very revered. Yes, South India. Yes. I thought he was supposed to be of that faith. Honorable members, at the start of before we consider health, we had an intervention earlier from the Honorable Member, Miss Natasha Singh Lewis, with respect to an education head, nursery school under the Ministry of Education. And it's had said that that particular allocation was for regions 1 to 10 and Georgetown. Uh, we have checked and we have checked with finance. The everyone was right in this case. There was no one that was wrong. The heading has 1 to 10 and it's been used before to make allocations that can supplement other areas. In this instance, the minister was right. It was for Georgetown schools. So the observation made by the honorable member, Ms. Natasha Singh Lewis, is on point. But the other part of her observation was there will need to be an amendment because we have tackled nursery education in the head on the local government. There is no amendment to be made. There are two separate allocations, two separate. The one that was raised with respect to 1 to 10, it's an observation, but it's been there and keep repeating itself budget after budget. So maybe the planners maybe next year put a little top up on it just in case we need to go throughout the whole country. Thank you for your observation, Honorable Member. Honorable Members, I seem to have lost my electronic version of the estimates. We have to bring him back. He's been, but I don't think we might be able to. We have to revise salary scales. Honorable members, let us turn to pages 458 and 459. Sorry, wrong place. Ministry of Health, hard copy. I'll have to revert to the old system of hard copy. Honorable members, it's now 10:30. Let me check the seconds. 10:30, yes. And I invite you to turn to pages 238 and 239. And I propose a question that the sum stated for Agency 47, Ministry of Health, Program 471, Policy Development and Administration, current expenditure stands part of the estimates. Honorable Member Dr. Cummings.
Thank you, Mr. Chair. 471, Policy Development and Administration. The expectation of the population then is for the Ministry of Health to provide effectively and efficiently financial management to the populace so that the health facilities can deliver quality care to the citizens of Guyana. Now, looking at the staff details, the chart of account, we have seen an increase of 6 persons, but a closer look at the chart of account from 611 to 6117 reveal that there's a decrease in the number of workers at the level of administration, except for 6113, which remains unchanged with 22 staff members, and 6116 contracted workers, where there's a 100% increase. Could the Honorable Minister tell this Assembly the percentage of departments which are fully staffed and with the staff complement, and which they are, or if there are vacancies to be filled?
Honorable Minister of Health.
Thank you very much, Mr. Chairman. Thank you very much, Honorable Member. Mr. Chairman, the section here and the different headings would have seen that there might be some variations, slight variations in the numbers of persons who were employed last year and those who are going to be employed or continue employment this year. And those variations are catered for, and we feel that we can competently manage the ministry with the numbers that we have in 2023.
Thank you. Minister, Honorable Member Dr. Cummings.
Thank you, Mr. Chair. 6116, contract workers. Could the Honorable Minister give the designations and the remuneration of the top 5 persons, employees?
Honorable Minister.
Thank you, Honorable Member. Among the top 5, that's what you're asking, top 5? Among the top 5 persons in this area would be the Ministerial Advisor, Permanent Secretary, Director of Materials Management Unit, the Director General, and the National Director of Pharmacy.
Thank you, Minister. Honorable
Mr. Chair,
Member,
I
Dr.
ask
Cummings.
for the designation and remuneration.
Honorable Minister.
So, Mr. Chairman, Honorable Member, the Ministerial advisor is in receipt of a pay of $866,000. Permanent secretary, $751,000. Director of Materials Management Unit, $648,000. The Director General, $635,000. And the National Director of Pharmacy, $432,000.
Thank you, Honorable Minister. Honorable Member Dr. Cummings.
Thank you, Mr. Chair. 6222, the revised allocation for 2022 was 17,632,000. However, there's an increase of approximately $4 million to this line item. Could the minister indicate to us what are some of the field items and supplies to be purchased under this line item?
Honorable Minister.
Thank you very much, Mr. Chairman. Under this line item, we have, as the Honorable Minister member rightly said, we have an increase of $4 million. That $4 million would be used for 30 pallets at the CSU, and we have another 30 pallets that would go to the MMU. So we can split it, 2 million for MMU and 2 million for CSU. The other amounts that we have there are for, we have at the MMU, we have to get protective gears, we have to get boxes to store things. Under this item as well, we are covering the ministry's information unit. And so we also have gears and utility coveralls for the persons working in that unit. We have also set aside for the admin department $4.9 million, and that is for them to get things like umbrellas and safety gear and so forth. For the budgeting and finance department, we have set aside about $1.1 million, and that is for them to get things like plastic storage containers, batteries, and so forth. For the Chief Medical Officer's office, that department would receive things like umbrellas, flash drives, and so forth. For the HR department, we have set aside $600,000, and again, similar gear. And we have a number of other offices that will receive similar things.
Thank you, Minister. Honorable Member Dr. Cummings.
Thank you, Mr. Chair. Item 6242, maintenance of buildings. There's an increase of $7 million to this line item. Could the minister state which are the buildings to be maintained and where are they located?
Honorable Minister.
Thank you very much, Mr. Chair. The increase here is approximately $6.9 million. And the maintenance that would be done includes the maintenance of the food policy building. We'll be doing some general maintenance work there. We have $1.9 million set aside to do the old administrative buildings. We need to do some drainage works, gutters and things like that on the building because we noticed leakages. And we also have, so basically under this line item, it would cover the maintenance of the head office building, MMU, and food policy buildings. So these are the three main categories of buildings.
Thank you, Minister. Honorable Member Dr. Cummings.
Mr. Chair, 6284, order. There's a steep increase in this line item. The revised 2022 allocation was 410,293,000, and now it has risen to 754,192,000. That's the proposed allocation for 2023. So it's an increase of approximately $344 million. Could you disaggregate this figure and let us know what are the items required for this operating, on this operating expenses.
Honorable Minister.
Thank you very much, Mr. Chairman. Thank you, Honorable Member. Um, Under this line item, we'll be doing a number of things, which include for the ministry, the information department, they are going to get a number of software, including a software from India called CoWIN, that is going to be used for not just COVID vaccination, but all vaccines. So that is something that we've been working on for quite some time. We also have under this line item sums of money set aside for the information systems that we're using at the MMU, which includes the MAC system, the licensing fees, and so forth for that. We also have set aside sums of money here for administration, which includes waste disposal, courier services, and so forth. And we have a sum of money that has been set aside for us to buy a new Nortel system. This is a telephone system that the ministry would be using. We also would be buying a new software called Delta Dynamics Facilities Management Software. So this would also be included here. Mr. Speaker, under this line item as well, as I think everyone now knows that last year, June, we signed an agreement with Mount Sinai to provide consultancy services to the Ministry of Health. Those services would include the improvement in the efficiency and management of the Georgetown Hospital. So apart from that, is to help us to develop a new oncological services, new cardiovascular services. We're also looking at upgrading national guidelines in terms of diabetes, hypertension, cardiovascular diseases, and so forth. And they have been helping us to do the electronic health record system. So a provision has been made here for that consultancy.
Thank you, Honorable Minister. Honorable Member Dr. Cummings.
Okay, thank you, Mr. Chair. 6302. What types of training is earmarked to be done in 2023 that would require an additional 10,771,000? And which category of staff would benefit from this, of such training?
Honorable Minister.
Thank you, Mr. Chairman. Thank you, Honorable Member. The $10 million, what we did was to break that down for continuing medical education, especially for allied professionals. These categories of people now require to do CMEs. They haven't been doing that, but we're making that a requirement for them to get their license. I think that's a very important step. We have set aside another sum of money here for the pharmacy assistance program. These are assistants that we'll train in terms of pharmacy. There are also a number of occupational health and safety training that would be done for various categories of staff. And we also have to do training for our encoders to be up to date with ICE CD 11, so that when they're coding birth certificates and death certificates and that sort of thing, they're up to speed. In addition to that, we have set aside a sum of money under the CMO's office for continuing medical education for doctors. We want to, every year, offer X amount of CMEs to doctors, especially those who are serving in the interior of Guyana. We have set aside monies for training of the health information department in the use of certain software. And we have also set aside monies for training of employees in the Human Resource Department. We have set aside monies for training for nurses and midwives under the Chief Nursing Officer's office. And again, it is it is now a requirement that nurses who would be registering must have continuing medical education. So as a ministry, we want to offer X amount of CMEs so that anybody can come and access those CMEs. Those are some of the things that we have on the training.
Thank you very much, Honorable Minister. Honorable members, I now put the question that the sum stated for Agency 47, Ministry of Health, Program 471, Policy Development and Administration, current expenditure stands part of the estimates. Those in favor say aye. Those against say no. Ayes have it. The sum stated now stands part of the estimates. Honorable members, let us turn to page 517. And I propose a question that the sum stated for program 471, Policy Development and Administration, Capital Expenditure, stands part of the estimates. The Honorable Member, Dr. Cummings.
Thank you, Mr. Chair. Project code 1216200, Ministry of Health Buildings. Could the minister tell this august body if on receiving this local financing of 160,645,000, if the building and bond would be completed?
Honorable Minister. Honorable, repeat,
I'm
please.
asking project code 1216200. You found it? Yes, there's money allocated there for completion of the building and the bond.
So under that heading, Mr. Chairman,
Go ahead, Minister.
there is $74 million that have been allocated for the completion of the ministry's head office. And we know the history of that. Consultancy, since we have extended the construction time for the building, we have to also extend the supervisory contractors' time. And so there are some monies catering for that. So we have here $74.1 million for the construction, and we have $5.2 million for the supervisory contractor.
Thank you, Minister. Honorable Member, Dr. Cummings.
Thank you, Mr. Chair. Project code 2405600. A sum of 20 million has been allotted for the purchase of a vehicle. Could you give us the specs for the bus? What its intended purpose for the use of this bus?
Honorable Minister.
Thank you, Mr. Chair. Thank you, Honorable Member. This bus is really being procured by the Materials Management Unit. We have a number of staff that would travel from, let's say, Georgetown to go to Diamond. And we have been providing transportation for them. So instead of renting or contracting somebody to take them up every morning and bring them back in the evening, the ministry has decided it would be more economical for us to buy a bus and operate that bus. So this is providing for us to buy a 30-seater bus so that we can move the staff to the MLA.
Thank you, Minister. Honorable members, I now put a question that is sum stated for program 471, Policy Development and Administration, Capital Expenditure, stands part of the estimates. Those in favor say aye. Those against say no. Ayes have it. Sum stated now stands part of the estimates. Honorable members, please turn to pages 240 and 41 of your estimates. And I propose a question that the sum stated for Program 472, Disease Control, Communicable Diseases, Current Expenditure stands part of the estimates. Honorable Member Dr. Cummings.
Thank you, Mr. Chair. Mr. Chair, valiant efforts are being made to reduce the incidence and prevalence of infectious diseases. Looking at line item of 6116, could the minister tell us the number of persons who have been contracted via the donor agencies? Of course, we know the TB, HIV, malaria program, that's a donor fund. So how many persons are on that program, the employees and their remuneration?
Minister.
The top three positions.
Thank you, Honorable Member. In terms of the under-contracted employees, the top 5 would be the medical officer that would receive a salary of $491,000, 491.3 per month. The national UCT coordinator at $339,000 per month. Key population officer at $241,000. Microbiologist at $200,000, and a surveillance officer at $200,000.
Thank you very much, Minister.
That's
Honorable Member Dr.
that's for
Cummings.
the to the chair for the regular establishment, but for the donor agencies, Global Fund, for example.
Yeah. So the challenge that we have here, Mr. Speaker, is that Global Fund, we have currently a project in HIV, we have one in malaria, one in TB. And the Global Fund has been phasing out these programs. And over the last couple of years, under the Global Fund, they are all now absorbed under the ministry. And the funding, the bridging funding that we have going forward is mostly for studies that we have to do and conclude. And so there isn't really any substantive money to fund anybody under the Global Fund.
Mr. Chair, if I can follow
Honorable
up.
Member.
Yeah. I know this unit would have been doing disease surveillance at the regional and even the national level. Do you think you would be able to reach this goal of 62 as the program performance would have indicated? Do you have sufficient staff members to diagnose and treat patients with developmental disabilities?
Honorable Minister.
Thank you very much, Mr. Chairman. Thank you very much, Honorable Member. Indeed, our main services for leprosy is at the farms. And right now and under this budget, we are actually investing a lot of money to upgrade the services that we provide there. We have included a special laboratory and other equipment so that we can make more efficient diagnoses. Now, the numbers that you mentioned, those are estimates. Guyana has, over the last couple of years, achieved elimination at the national level. And for the WHO purposes, elimination is considered less than 1 person per 10,000. So we have achieved that at the national level. However, we have a couple of regions where we see it is more than 1 per 10,000. And therefore, we have targeted those regions with specific programs so that we can reduce that to the 1 or less than 1 per 10,000. So the drive that we have right now is to bring that down so that Guyana can be considered as having eliminated leprosy from the country. So that's our goal. We have, by the WHO standards, to achieve that by 2030. We are hoping that we can get there by 2025. Okay.
Thank you, Minister. Honorable Member Dr. Cummings.
Thank you, Mr. Chair. 6241. The figure stands at 318,458,000, an increase from the revised 2022 figure of 245,358,000, which is really an increase of 73,100,000.
Rental for the staff who are working at the infectious disease hospital, because we have staff that are coming from out of town, and since we've been bringing them down from Lima, it also caters for a building that we are renting for our surveillance staff. So the surveillance unit is housed in a particular building. So we continue paying that rent. We are also paying here for rental of a storage bond. This is a bond that we have rented for pharmaceuticals, and we have, under this heading, have been paying for that.
Thank you, Honorable Minister. Honorable Member Dr.
Just to
Cummings.
follow up, Mr. Chair, what has become of the building at Kwame Street? I thought the nurses would have been using that. It's not?
Honorable Minister.
The building, the Kwame Street. We had renovated that building to rent to maybe staff, and so what has become of it?
That's the Waterloo Street building? Yeah. That is basically for the Georgetown Hospital, and it's mostly for doctors.
Thank you, Honorable Minister. Honorable Member Dr. Cummings.
Line item 622, field materials and supplies. Could the Honorable Minister give us a list of the field supplies to be purchased under this line item? In 2022, the revised amount was 83,334,000, but for 2023, there's a steep rise of 220,996,000, a whopping increase of 137 million. What is responsible for this increase?
Honorable Minister.
Thank you very much, Mr. Chairman. Thank you very much, Honorable Member. The increase of $137 million is really for the procurement of insecticide-impregnated bed nets. So we will be buying 73,000 bed nets. That would include, 73,000 bed nets, and we'll have another 58,000 hammock nets. So this would be distributed to communities in the interior, regions 1, 7, 8, 9, 10. And really it's to help us to control malaria.
Thank you, Minister. Honorable Member Dr. Cummings.
Thank you, Mr. Chair. Line item 6223, office material and supplies. There's also an increase of approximately 6 million. Could the Honorable Minister tell members of this committee what are the items to be purchased and to where?
Honorable Minister.
Thank you, Mr. Chairman. This year, we have budgeted to buy labels for the National Public Health Reference Lab. So labeling samples, especially COVID-19 tests and other types of tests that would be done there. And so that's what they're projecting that it would cost, for about 50,000 laboratory labels.
Thank you, Minister. Honorable Member Dr. Cummings.
Prior, you had mentioned rental of buildings for staff, but in 6241, there's also rental of buildings, if I'm correct, 6241. And so could the Honorable Minister tell us which are the buildings to be rented for this program and where they are located and the required sums of these buildings, for these buildings?
Honorable Minister.
Mr. Chairman, one of the building is located in Bel Air. Another building, yeah. I'm trying to get the address. Where is the surveillance staff? Huh? The one housing the surveillance staff is in Milton Street. And then you have another one in Kitty. They're looking for the addresses, so I could give them to you.
Thank you, Honorable Minister. Honorable Member, Dr. Cummings.
Line item 6284, this is order, could the Honorable Minister disaggregate this line item as there's an increase of 14,870,000?
Honorable Minister.
Thank you, Mr. Chairman. This item caters for rental of equipment, support for the mass drug administration program, providing machines to do fogging and so forth. So it's disaggregated for $2.9 million going to the infectious disease hospital, $3.1 million for filaria, $2.5 million for HEOC, $2.3 million for the National Public Health Reference Lab, $1.8 million to the Vector Control Department, $1.3 million for TB, $1.2 million for the National AIDS Program Secretariat, 1.2 for the Veterinary Public Health Unit, 400,000 for the Epidemiology Unit, and about $100,000 for admin.
Thank you, Minister. Honorable members, Dr. Cummings.
The entomology unit, I thought by now we'd have gotten a building for that. I think we were doing some work there. And also you have dismantled the ATOC. You have a substitute for that. ATOC, we had it for COVID. You have dismantled that. You have replaced it with something else?
So the entomology building is still on Thomas land, and we will be looking for suitable sites to possibly construct a different building for that department. But that's not in this budget. In terms of HEOC, HEOC remains functional because we still do have cases of COVID. As of today, we had about 15 persons over the last 24 hours, 15 persons or so who tested positive out of 255 tests that were done. We have about 133 people with active COVID, and we have 12 persons in the hospital. So we still have cases, and therefore we still have to maintain the system to ensure that we can coordinate the different hospitals and so forth.
Thank you, Honorable
Mr. Chair, I
Member.
just want to let the minister know we're going to an oil-rich country, we're building maternal hospitals and so on, but gene sequencing could be probably in the next budget. I haven't seen it here. Anything for gene sequencing for the public health lab?
Honorable Minister, is gene sequencing included?
Thank you
Or
very
will be
much.
later?
Thank you very much, Mr. Speaker. It is something that we are working towards, and I'm very happy that the honorable member mentioned that. In fact, last year, we have a partnership with Harvard University, and through that collaboration, we have brought down a gene sequencer which is housed at the National Public Health Reference Lab, and we were able to use that sequencer to do Plasmodium falciparum. So we have sequenced the Plasmodium falciparum, looking for gene mutation that can code for resistance to the current medications that we are using. Fortunately, we haven't found any such mutation, but we do have a sequencer at the public health reference lab now, and that was because of this collaboration. Of course, we want to extend that, and we are going to, in some cases, we have spoken to the guys at Harvard to be able to have the reagents to repurpose it so that we can do sequencing for variants. So that's something that we're working on. And our staff at the reference lab has been trained. They went up to Harvard. They spent 6 weeks there. They got good training in terms of how to do sequencing. So we have capacity. So when you said that, it's not a far stretch for us to start expanding into these areas.
Thank you very much, Honorable
Aaron, I just,
Minister, honorable members. I
Mrs.
now put the question that the
Mr.
sum
Speaker. Mr.
honorable
Speaker.
member, Ms. Ferguson.
Thank you very much, Mr. Speaker. Mr. Speaker, through you to the honorable member, very quickly. Line item 6272, electricity charges. I note for last year, we had a budgeted sum of some 50 million, and then we had a revised amount of 120 something million. I note for 2023, you're now seeking 78 million. Is this figure adequate, and what would have occasioned the decrease? While it's welcoming.
Honorable Minister.
Thank you very much, Mr. Chairman. Thank you very much, honorable member. Very astute observation. But this really is to pay off some arrears that we had from previous years. So we were able to pay that off, and now the amounts that we have here would cover our annual amounts. So this is a realistic number.
Thank you, Minister. Honorable members, I now put a question that the sum stated for Agency 472, Disease Control, Communicable Diseases, current expenditure stands part of the estimates. Those in favor say aye. Those against say no. Ayes have it. Sum stated now stands part of the estimates. Honorable members, please turn to page 517. And I propose a question that the sum stated for program 472, Disease Control, Communicable Disease, Capital Expenditure, stands part of the estimates. Honorable member, Dr. Cummings.
Thank you, Mr. Chair. Project code 1216200, Ministry of Health Buildings. Provision is being made for an X-ray room. Where will this room be located, and do you have sufficient X-ray technicians to serve this department?
Honorable Minister.
Thank you very much, Mr. Chairman. Basically, the TB department has been asking for an X-ray unit for a number of years because they want their patients to be able to get the X-ray right on site, prevent them from being lost to follow-up and all that. So this provision is really to install an X-ray unit right at the TB clinic so that patients can have access to that, to get access to medical imaging right in the unit. So this $9 million is to do the room so that we can do the installation of the X-ray unit. The unit is already bought, so we are now awaiting retrofitting the room so that we can install this.
Honorable member, Dr. Cummings.
Yes, thank you, Mr. Chair. Project code 2509000. It speaks to the purchase of medical equipment. Could the Honorable Minister list the medical equipment to be purchased, as same has not been specified in the ledger? And to where will this new equipment be located?
Honorable Minister.
Mr. Speaker, it's a very long list of equipment that you'll be buying. But maybe I'll just say that some of it, like for example, a CD4 machine, would be placed at the National Public Health Reference Lab. As I said before, we are buying a lot of equipment for the leprosy clinic. So you have a number of analyzers and things that they require. So basically, most of the equipment would go to the National Public Health Reference Lab and the new laboratory that we're setting up for the leprosy clinic.
Thank you, Minister. Honorable Member Dr. Cummings.
Thank you, Mr. Chair. Project code 4405200, COVID-19 response program. The International Development Association, IDA, is a very meticulous financial institution. Do you have a plan for this initiative, and how will it be rolled out? And could this committee be given a copy of that if you have a plan?
Honorable Minister.
Response plan.
Thank you very much, Mr. Chairman. Thank you very much for the question. We have a loan with the World Bank, and under that loan, we have procured a number of things. This year, we intend to procure equipment and reagents for our laboratories so that we can strengthen what we're doing at GPHC and the National Public Health Reference Lab. And at all the regional reference lab, we'll be adding equipment. We'll also be doing work with our cold chain, so refrigerators and other things that they need, they would be getting it through this program. Hospital equipment, we have a very comprehensive list of our hospital equipment, and this would be going to all the different hospitals to ensure that they have capacity to be able to treat patients with COVID, but the equipment can be used for other ailments. So once it's a critical patient, we would be able to treat them, and this is going to help us to do that. We also have set aside money for transportation, and so we're buying a number of ATVs for remote communities under this program. We have set aside a sum of money for surveillance, so as to improve surveillance across the system. And we have also set aside some monies to do promotional activity to get people to come to our vaccination drives and things like that. In terms of some of the equipment that we are buying, we note where there have been a gap in terms of biosafety cabinets. So we are buying 6 new biosafety cabinets. We are buying 6 new gene expert machines. We are buying some bronchoscopes. So if we have to intubate, that we can intubate people properly. We have blood gas analyzers. We have hematology analyzers. We have biochemistry analyzers, and so forth. In terms of some of the equipment for the hospitals, we have anesthetic machines, we have autoclaves, we have infant bronchoscopes, cardiac beds, cardiac monitors, hospital beds, defibrillator machines, digital x-rays, we are buying 4 of those. Portable x-ray unit, we are buying 6 of those. Examination beds, we have 15 of those. ICU beds, we are getting 20 of those. Infusion pumps, 20. Laryngoscope, 8. Spirometry machines, 5. Oxygen concentrators, 12. Portable fetal machines, we are getting 3 of those. Portable ultrasound, 6 of those, and so forth. So there are a number of equipment that we are getting for the various hospitals under this program.
Thank you very much, Honorable Minister, honorable members. I now put the question that the sum stated for Agency 472, Disease Control, Communicable Diseases Capital Expenditure stands part of the estimates. Those in favor say aye. Those against say no. Ayes have it. Sum stated now stands part of the estimates. Honorable members, let us turn to pages 242 and 243. And I propose a question that the sum stated for program 473, Family and Primary Healthcare Services current expenditure stands part of the estimates. The Honorable Member Dr. Cummings.
Mr. Chair, you would agree with me that infant mortality is an important marker of the overall health of the society. In fact, it's a guide us to life expectancy of the country. Mr. Chair, this program is an important program as it considers, in fact, it covers the full continuum of essential health services, not only the infant mortality, but child and maternal mortality. In the light of expanding program and to address the inequities, Mr. Minister, do you think there is adequate staff to provide quality care to men, women, and children? There is a reduction of 33 employees. Once again, do we have vacancies?
Honorable Minister.
Thank you very much, Mr. Chairman, and thank you very much for that question. One of the things that we'll be doing is strengthening our primary healthcare services. So we took a step last year of looking at each level of service and what are the interventions we want to offer at each level. And we have come up with about 216 interventions at health posts and at the health center level, which include maternal and child health services. And what we have been doing now is to retrofit the physical facility. So we have done some of that work last year. We're going to continue to do some this year. We are buying the necessary equipment to be able to do that. And in terms of human resources, we are also expanding and training more people. So for example, in Regions 1 and Regions 9, we now have at every health post or health center, we have at least 2 community health workers. They have been trained over the last 2 years. And that type of expansion is going to continue. We are working very hard to launch a registered nursing program online. And as soon as that opens, we expect that we should be able to get about 1,000 persons applying to do registered nursing. This is a 3-year program, and every year we are hoping to attract at least 1,000 persons into that program. So over time, we would be able to get the relevant human resource that we need to operate the system. We are also training people in pharmacy, pharmacy aid, and there are a whole host of other programs that we're working on simultaneously. We have decentralized some of these programs so we can get people from the respective regions to be trained. So yes, we understand we have some human resource deficit, but we are actively working to address that. And these are the ways in which we're doing that.
Thank you, Minister. Honorable Member Dr. Cummings.
Mr. Minister, Mr. Chair, before I go on to 6116 contracted employees, I just want to ask, it would be remiss of me not to ask this policy question. Because of course, maternal deaths, and so it's a topical issue. And so in 2000, it was reported that 12.4 billion was allocated for a pediatric and maternal hospital, among other healthcare investments. And so could you tell us how much of that money was spent on the pediatric hospital so far? Could you also share with this National Assembly what has been done, what work has been done on the project, and how the contractor was identified to undertake this job? Could you also tell us what is the status of the design and the other works on this hospital? Since you have a design in mind, could you tell us how many beds in hospital it will have? Could you say how the hospital will be financed? Could you inform this assembly what is the projected final cost of the hospital, including equipping it? Could you say when the hospital will be completed and what arrangements are being made to put in place to ensure that the hospital will be properly and adequately staffed?
Honorable Minister.
Thank you very much, Mr. Chairman. Thank you very much, Honorable Member, for that question. Indeed, we are building a maternal and pediatric hospital, and that hospital would have 256 beds. We have just recently concluded the detailed design of the hospital, and we had a team from the Georgetown Hospital uh, pediatrics department, uh, who provided a lot of the technical inputs into what should go into the pediatric section of the hospital. We also had a number of the consultants from the obstetrics department of the Georgetown Hospital who participated in the technical design of the obstetric side of the hospital. This hospital is being built by VAMED. VAMED is an Austrian company that has done more than 1,000 hospitals around the world. And you might recall, honorable member, that the Austrian government and the government of Guyana in 2018 signed an agreement, and through that agreement, helped a number of facilities were earmarked for development. Under that agreement that was signed, I think, by the Honorable Walter Lawrence, one of the facility that was earmarked was the Georgetown Public Hospital. When we came into government, we reviewed the agreement, and we decided at the time we wanted to build a maternal and child health hospital, and we amended that agreement. So it's under that agreement that we are building this maternal and child health hospital. We, in terms of the financing, we are using the UK banks to finance this hospital, and it is at a very, very concessionary rate, and therefore, through this arrangement of the MOU, we have been able to do this quite successfully. The hospital, we have started the construction, well, we have started the work on the hospital. As I've said, when you're doing construction, you first have to do the design phase. The contractors were given 6 months to do the designs. This contract was signed on sometime in June last year, and they have now more or less completed the designs. While they were doing the designs, they have also started doing site preparations, and so the site is now prepared, and very shortly we expect that they would be able to start putting down the foundation and start building the hospital. This hospital is slated to be completed by early 2025, and they have, from the time of signing, I think they have 36 months in which to complete this hospital. hospital. And hopefully we'll be able to operate on the first 20 or so children that has various types of cardiac problem this year. And we are hoping that we can continue that program. So when the hospital opens, it's a natural flow where this team that is going to be at the Georgetown Hospital now would go across to the hospital. So we have started this type of planning. With nurses, again, we have some specialized training that we're working on. We have some partnerships with universities in Canada to get some of our nurses specialized in the areas that we need them to be in the new hospital. And we have a partnership, as you know, with Brazil, where a number of nurses have gone there to get further training. And that is going to continue because we continue to have this type of partnership.
Thank you, Honorable Minister. Before you take the next, just clear up something from my mind. I thought we were dealing with current. What you described seemed to have been a capital project. Is it included here? No? Thank you. Honorable Member Dr. Cummings, I didn't want to stop you, but um, let us ask questions pertaining to this particular head. And I'm sure there are opportunities in other places to go and ask questions pertaining to capital. Go ahead, Honorable
Thank you,
Member.
Mr. Chair. Yeah, I was deciding whether it's capital or policy, but it's okay.
Yeah, but we have a lot of information in the legends, in the
Yes.
volumes that will guide us.
Line item 6116, contracted employees. What is the reason for the increase of 88 million 565 in this line item? It was moved from 215 million 977 to 304 million 542. Could the Honorable Minister indicate to the members of this committee the remuneration package and the designation of the top 5 employees from this line item?
Honorable Minister.
Mr. Chairman, the top 5 people under this category would be dental surgeons. A dental surgeon would now receive $555.8 thousand per month. A prosthodontist at $450,000 a month. A maxillofacial surgeon at $450,000 a month. A coordinator for health strengthening at $432,000, and 1 staff nurse at $351,000.
Honorable Member Dr. Cummings.
Yeah, 6112, senior technical. Could the Honorable Minister state the top 5 persons in the remuneration package and designation? What is the reason for the increase from 185,390,000 to
Honorable Minister.
207,685,000?
Mr. Chairman, the top 5 here would be the Director of Primary Healthcare Services at $660,000 per month, an orthodontist at $450,000 per month. We have a prosthodontist at $450,000, a senior dental surgeon at $450,000, and a maternal and child health officer at $400,000.
Thank you, Minister. Honorable members, I now put a question that the sum stated for program 473, Family and Primary Healthcare Services, current expenditure stands part of the estimates. Those in favor say aye. Those against say no. Ayes have it. The sum stated now stands part of the estimates. Honorable members, before I move to the next head, we have 12 programs to come and 30 minutes to deal with them. Honorable members, I now ask you to come to page 517, and I propose a question that the sum stated for program 473, Family and Primary Healthcare Services, capital expenditure, stands part of the estimates.
Project
Honorable
code,
Member Dr. Cummings.
yeah, project code 1216200, Ministry of Health buildings for a maxillofacial clinic and a vaccination bond. Payment for retention at the cost of 21 million. Is the bond located at Kingston? Where is this new bond located?
Honorable
There was not much
Minister.
detail in the legend.
Thank you very much, Mr. Chairman. Thank you, Honorable Member. The bond is at Kingston. There's an upper floor that is being constructed.
Thank you very much, Honorable Minister. Honorable members, I now put a question that the sum stated for Program 473, Family and Primary Health Care Services, capital expenditure stands part of the estimates. Those in favor say aye. Those against say no. Ayes have it. Sum stated now stands part of the estimates. Honorable members, pages 244 and 245, and I propose the question that the sum stated for Program 474, Regional and Clinical Services, current expenditure stands part of the estimates. Honorable Member Dr. Cummings.
Line item 6116, there's an increase in the number of contracted employees, moving from 610 employees with a filled vacancy in 2022. Now you have, and that was to a tune of 1,694,013. When compared to 795 employees to be filled in 2023, and to a tune of 2,710,133,000. It's an increase of and there's an increase of 185 persons. Could the minister state the top 5 personnel that make up this category of healthcare workers and their designation and emoluments?
Honorable Minister.
Thank you very much, Mr. Chairman. The top 5 here would be the Chief Executive Officer of the New Amsterdam Hospital at 993,000, a neurosurgeon at $899,000, Regional Health Officer at $848,000, consultant for obstetrics at $749,000, and another consultant at $732,000.
Thank you, Minister. Honorable members, I now put a question that the sum stated for Program 474, Regional and Clinical Services, current expenditure stands part of the estimates. Those in favor say aye.
Items, the number of ambulance to be purchased, the location, the number of vehicles to be purchased, specs, so etc.
Honorable Minister.
Thank you very much, Mr. Chairman. Thank you, Honorable Member. Under this line item, we'll be buying 1 minibus. We have budgeted approximately $7 million. 2 double cab all-terrain pickups at about, we approximate the cost about $9 million. So that's about that would be $18 million. We're looking at motorcycles, 5 motorcycles at $2.3 million. All-terrain ambulances, 2 at $32,000 for the 2 ambulances. We also have ATVs and ATVs accessories, 11 ATVs at $23.1 million. And we have 1 boat engine, and that's at $2.5 million.
Thank you, Minister. Honorable members, I now put the question that the sum stated for Program 474, Regional and Clinical Services Capital Expenditure, stands part of the estimates. Those in favor say aye. Those against say no. Ayes have it. Sum stated now stands part of the estimates. Honorable members, please turn to pages 246 and 247. And I propose a question that the sum stated for Program 476, Standards and Technical Services Current Expenditure, stands part of the estimates. The Honorable Member, Dr. Cummings.
Standards and Technical Service 6116. There's a drastic increase of contracted employees, moving from 4 employees to 65, with a concomitant increase from $19 million in 20, that was the revised amount in 2022, now to 143,215,000. Could the minister tell us what is the reason for this drastic increase, and could the minister give us the designation and remuneration package of the top 3 employees?
Honorable Minister.
Thank you very much, Mr. Chairman. A number of persons came on as contracted employees. I think there are about, I don't have the sum here, but there are quite a number of people who came on as contracted employees. That's why there's an increase. But the top 3, we have superintendent of pharmacies. That person receives about $679,000. Food inspector at $219,000, and an admin officer at $166,000.
Thank you, Minister. Honorable Member, Dr. Cummings.
6302, training, including scholarship. In 2022, there was a revised sum of $24,122,000 and a budgeted sum of $41,900,000. There's now a budgeted sum for $41,900,000. Could this minister let us, this August body, know what is the reason for this increase in this line item?
Honorable Minister.
Thank you very much, Mr. Speaker. The increase amounts to about $17.7 million. And what we intend to do is a number of training in terms of laboratory services, quality of laboratory service and things like that. And we are working to get need to be at a certain level. So we'll be spending $12.9 million for training in our labs. We'll be spending $3 million to train persons at the Food and Drug Administration, and $1.3 million for the National Blood Transfusion Services. So this is their specific training that they have to undergo so that they can keep their accreditation with the Association for Advancement of Blood and Biotherapy. Mr. Chairman, the rest of the money would be spent on quality assurance. We'll spend some additional money on the National Blood Transfusion Services, regional support services, government pharmacy, and the Food and Drug Administration.
Thank you, Minister. Honorable members, I now put a question that the sum stated for Program 476, Standards and Technical Services Current Expenditure, stands part of the estimates. Those in favor say aye. Those against say no. Ayes have it. The sum stated now stands part of the estimates. Honorable members, we can turn to page 518. And I propose the question that the sum stated for Program 476, Standards and Technical Services Capital Expenditure, stands part of the estimates. The Honorable Member, Dr. Cummings, has no questions, so I'll now put the question, and I put the question that the sum stated for Program 476, Standards and Technical Services Capital Expenditure, stands part of the estimates. Those in favor say aye. Those against say no. Ayes have it. The sum stated now stands part of the estimates. Honorable members, please turn to pages 250 and 251. 51. And I propose the question that the sum stated for program 477, disability and rehabilitation services, current expenditure stands part of the estimates. The Honorable Member, Dr. Cummings.
6294, there is an increase from 18,960,000 to 29 million, an increase of 10,040,000. What is the reason for this increase, and could the minister tell us what constitutes order?
Honorable Minister.
Thank you very much, Mr. Chairman. Thank you very much, Honorable Member. Mr. Speaker, this year we'll be spending $29 million. 23 million would go towards buying of hearing aids to persons who require them. And as you know, as of last year, we started to give these hearing aids free of cost. So before that, people had to pay $65,000 for a hearing aid. So now they're going to get it for free. We are also going to be spending $4.2 million to buy wheelchairs for persons who need them. This year, we have introduced another thing, and that is to buy offloading footwear for patients who are diabetic. So a sum of money has been allocated for that. We have a sum of money for walkers, clutches, and so forth. So that's what this $29 million is.
Thank you, Honorable Minister. Honorable Member, Dr. Cummings.
6112, senior technical, there is a decrease in the staff complement from 43 to 39, with an increase from 95,844 to 108,778, an increase of 12 million. Could the Honorable give the designation emoluments for the top 3 employees?
Honorable Minister.
Thank you, Mr. Speaker. The top 3 here would be the Director of Rehab Services, who's receiving $660,000. Optometrists, $350,000. Physiotherapists at $245,000.
Thank you, Minister. Honorable members, I now put the question that the sum stated for program 477 on pages 250 and 51, disability and rehabilitation services current expenditure stands part of the estimates. Those in favor say aye. Those against say no. Ayes have it. The sum stated now stands part of the estimates. Honorable members, let us turn to pages 518 and 519. This is the additional. Honorable members, just give me one moment. I'm asking the Deputy Speaker if he could just come forward a bit as we welcome the other 30 students from Camille's Institute, Sustek. Honorable members, I now propose a question that the sum stated for Program 477, Disability and Rehabilitation Services, capital expenditure stands part of the estimates. Honorable members, I now put a question that the sum stated for Program 477, Disability and Rehabilitation Services, capital expenditure stands part of the estimates. Those in favor say aye. Those against say no. Ayes have it. The sum stated now stands part of the estimates. Honorable members, let us turn to pages 252 and 253. And I propose the question that the sum stated for program 478, disease control, non-communicable diseases, current expenditure, stands part of the estimates. The Honorable Member, Dr. Cummings.
Thank you, Mr. Chair. Mr. Chair, this is a very important department, as 70%, almost 70% of our budget comes under NCDs. I just want to ask the minister, when we were in government, we formed the NCD Commission. And I don't know what has become of that. It's still operable? It's not stated in the line item, and I can't find it in the ledger and the appendix at the back. So can we find it, the allocation? Where is that allocated? You have the NCD Commission. Do we have a building? Do we have a person in charge? And where can we find where it's being persons being paid from the
Honorable Minister.
Thank you very much, Mr. Chairman. Thank you very much, Honorable Member. The commission is operational, but you missed it. It's under Program 1.
Thank you, Honorable Minister. Honorable Member, I'll allow you to go back to, if you wanted to, ask him a question.
It's okay.
It was program-wise, okay?
Yes, yes.
Go ahead.
Yes. 6222, drugs and medical supplies. Could the minister please tell us why such an increase from 1,032,000 to 391,400,000? This corresponds to whopping increase of 231,368,000. What are the drugs and medical supplies to be purchased under this line item?
Honorable Minister.
Thank you, Mr. Chairman. That line item for drugs and medical supplies would be 6221. Right? That's what you're asking?
Yeah. Honorable.
So there are a couple of things that we are doing. One, we are looking at, well, we started this program last year, HEARTS, and we are rolling that out to more health centers now. So the medication required for that particular program is much different from what was generally being used. So we'll be spending $79.3 million for that particular program. We have also set aside $22.6 million to do prevention of cervical cancer. And this is to do, well, in the previous program, we didn't go into that, but we are doing HPV vaccination rollout through that program. And here we will be doing VIA screening, HPV screening, and so forth. We have set aside $82.7 million for insulin. We have a number of diabetic patients that require insulin, and therefore we have to buy and supply them with insulin. Including, we have 183 children that would receive insulin because they have type 1 diabetes. Mm-hmm. We have $6 million set aside for persons with kidney diseases, and we have set aside $12.9 million to do respiratory management. So what we are seeing now with some patients that have long COVID, that they have challenges breathing, and they have some long-term challenges, so they will require special attention, spirometry on a regular basis, and then to have the physiotherapy department work with them so that they can get some improvement in their breathing.
Thank you very much, Honorable Minister. Honorable Member Dr. Cummings.
6282, equipment maintenance, a revised sum of 3,383,000 was budgeted for in 2022, but this sum has been increased to 22,172,000. Could this Honorable Minister state what equipment is to be maintained in this program?
Honorable Minister.
The equipment here is basically to do the office equipment that they have at in their office. So we've set aside some money here for AC units and fridges, AC units, fridges, and things like that. So it's a small sum of money.
Thank you, Minister. Honorable members, I now put a question that the sum stated for Program 478, Disease Control, Non-Communicable Diseases Current Expenditure, stands part of the estimates. Those in favor say aye. Those against say no. Ayes have it. The sum stated now stands part of the estimates. Honorable members, please turn to page 519. And I propose a question that is some stated for Program 478, Disease Control, Non-Communicable Diseases Capital Expenditure stands part of the estimates. Honorable members, I now put a question that is some stated for Program 478, Disease Control, Non-Communicable Diseases Capital Expenditure stands part of the estimates. Those in favor say aye. Those against say no. Ayes have it. The sum stated now stands part of the estimates. Thank Honorable Minister would like to say something.
Yeah. Mr. Chairman, did we miss health sciences?
Yes, we did.
Okay.
Yes, we did. Honorable members, I now pull your attention to 518, and we missed health sciences capital expenditure. Or did we miss both current and capital? Both. Honorable members, I'll now put this, that's on page 246 and 247. And I propose a question that the sum stated for program 475, Health Sciences Education, current expenditure, stands part of the estimates.
Mr. Chair, the minister boasts that there will be more training for healthcare workers, but there are not adequate staff to carry out this training. There is a decrease in your senior technical staff from 27 in 2022 to 19 in 2023, a reduction of 7 employees, as seen in the chart of account 6112 and 6116 respectively. The performance indicator has been suggested at a goal of 14:1 in terms of student-tutor ratio. Is targeted for 2023. How does the minister plan to build this capacity of healthcare workers when you have a shortage of staff?
Honorable Minister.
Thank you very much, Mr. Chairman, and thank you very much for that question. So the people who we have currently enrolled as tutors and so forth would continue, and we'll probably recruit some more as we expand the programs. But we are also now using a lot more of the capacity that we have within the system. That is the doctors, senior nurses, who can all work as tutors because they're doing both the theory and the practical. So we intend, as we expand training, to get a lot more of these persons involved. So for example, let's say in Regions 6, we have been involving more of the medical staff to be part of the teaching program. Similarly in Linden and other places. One of the reasons why we were able to decentralize some of these programs is because of our medical staff are now also doing some teaching.
Thanks, Honorable Minister. Honorable Member Dr. Cummings.
6302. Training. A revised 265,080,000 was allotted in 2022, but there's an increase of 107%. Is it due to an increase in the stipends for nursing students, or is it to assist them with the partial recovery of health learning materials? What's the reason for this increase? 6302.
Honorable Minister.
So we spoke about this. One of the things that we'll be doing is moving the current registered nursing program from a classroom space to an online space. And we have been working on preparing the material. We have gone substantially, we have most of the material prepared. And we are now going to migrate that material on the online platform. So some of the monies that are allocated here is to do that migration, to maintain the system, where people are going to come and get registered. And when they need training and so forth, they need to go to class online, that platform would be stable and would be there. We are partnering with Coursera to be able to offer it on their platform. So we know that they have been doing this globally, and they have all the know-how of how to make sure that people continue learning on that virtual environment. So some of the monies that are here would cater for that migration of the program.
Thank you, Minister. Honorable Member Dr. Cummings.
6292, dietary. There is a revised amount of 61 million in 2022, but in 2023, there's a whopping increase of 528,120,000. Could the minister state what is responsible for this increase?
Honorable Minister.
So again, in terms of dietary, we have a lot more programs now, and we have decentralized them. So, for example, we have set aside $216 million for the programs that would be run in regions 1, 2, 7, 8, and 9. We have in region 9, for example, another program that we'll be running for nursing assistants that they would require dietary. So we have a whole list here of different programs and the people who we'll be bringing in for training, and we'll need to provide them with meals.
So would you lay it over for us, please?
We can.
Thank you, Honorable Minister. Honorable members, I now put the question that the sum stated for Program 475, Health Sciences, Education, Current Expenditure, stands part of the estimates. Those in favor say aye. Those against say no. Ayes have it. The sum stated now stands part of the estimates. Turn to page 518, honorable members. And I propose the question that the sum stated for Program 475, Health Sciences, Education, Capital Expenditure, stands part of the estimates. Honorable Member, Dr. Cummings.
Thank you, Mr. Chair. Project code 1216200, provision of nursing schools and payment for retention to a tune of 620 million. Could the minister please tell the committee where the construction, where's the location of this construction?
Honorable Minister.
Where is?
So under this heading, Mr. Speaker, we have set aside some monies to complete the generator hut at the New Amsterdam Nursing School. We are also completing work that was started at the New Amsterdam Nursing School. That's going to be about $119 million. And we have set aside monies to do a number of facilities, including one at Anna Regina, to build a nursing school in Essequibo. We are also going to retrofit some of the existing facilities, because one of the things when we move to the online environment of learning, what we'll also need is to have simulation centers. So where persons would be able to come in and do the practical component of nursing. So a lot of these centers are geared to offer that simulated environment where people would learn. So that's why we're building this facility in Region 2.
Thank you, Minister.
Project code 2508900, office furniture and equipment, 21 million has been allocated for this project. What are the furniture and equipment to be purchased, and which nursing school or schools?
Honorable Minister.
So, Mr. Speaker, we have under this heading desktop computers. We have 2. We have power backup. We have 15 of those. 6 laptop computers, 7 multimedia projectors. We have a photocopier. We have a multi-purpose printer, a line conditioner. We have 6 of those. Executive desk 1, office desk 5, executive chairs 8, metal covers 2, combination chairs 50, metal bed frame 19, those come with mattresses, podium 1, water tank 3, refrigerator 1, industrial oven 1, stabilizer, floor model, commercial food blender, and there are a whole host of other things here.
Thank you, Mr. Chair.
Thank you very much, honorable members, and that exhausts the time that we have for this agency. Honorable members, I now put a question that is some stated for program 475. Health sciences education capital expenditure stands part of the estimates. Those in favor say aye. Those against say no. Ayes have it. The sum stated stands part of the estimates. Honorable members, let us all thank the Honorable Minister and his staff for a very informative and efficient presentation. Thank you very, very much, Honorable members. Honorable members, we have the Ministry of Home Affairs Agency 51 next. I'm asking the staff if they can put an additional 2 seats in the front row for the Ministry of Home Affairs. As the Honorable Minister, Permanent Secretary, and the leadership of our security services get in place. As they do, can we turn to pages 260 and 261? And I'm reminded of a famous saying, I think it may have been a US president. He says, when you stand between your audience and a meal, you must be sincere, be brief, and be seated. Honorable Member, Ms. Geeta Chandan Edmond, I heard you did a lot of work and you are going to be concise and precise. And I trust the Minister will too. Thank you, Honorable Members. Pages 260 and 261, Agency 51, Ministry of Home Affairs. And I propose the question that the sum stated for Program 511, Policy Development and Administration, current expenditure, stands part of the estimates. Honorable Member, Ms. Geeta Chandan Edmond.
Thank you very much, Mr. Chairman. Through you to the Honorable Minister, I refer the Minister to line item 6116. There is an increase of 39 contracted employees. Can the Minister indicate to the House how many advisors fall within this category and the designations, emoluments, and benefits and the skill sets of the top 5 employees?
Honorable Minister.
Thank you, Mr. Chairman. And I want to thank the honorable member for her question. I am elated that she's still my shadow, but to answer the question, there is one ministerial advisor and at $520,000 a month, 10,000 duty and 10,000 entertainment. Oh, the top 5, of course, there's a permanent secretary, there's a director of juvenile justice, there's a business change and quality assurance officer, a head of strategic management department, and administrator of the utility services unit.
Thank you, Minister. Honorable Member, Ms. Geeta Chandan Edmond.
Thank you, sir. Minister, according to the performance statement, one of the ministry strategy is to formulate, implement, and monitor national security policies. Can you indicate the staff complement and their skill set that will deal with this?
Honorable Minister.
Thank you, Mr. Chairman and honorable member. The formulations and the relationships, the engagement in relation to national security policy is done
at different levels in the ministry and bringing together the skill sets from the police, the fire, the prison service, and also the specialized departments in the ministry.
Thank you, Honorable Minister. Honorable MP.
Thank you, Minister. But the question is very specific. I'm asking for you to indicate the staff complement. That simply means the number and their skill set. I understand that it's being drawn from different agencies. It's a simple question.
Thank you,
Honorable Minister.
Mr. Chair and honorable member. I did indicate that it relates indeed to the strategic management departments, both at the ministry and at the agencies, in terms of total complement and not adding specialists in the various areas of those departments and agencies, and also those of the ministry. It would number perhaps over 50 persons.
Thank you, Minister. Honorable Minister, Honorable Member.
Thank you again, sir. That's an answer I'm comfortable with. Again, according to your performance statement, you are seeking to reintroduce reformed prisoners into the community. Can you indicate how many of your staff are trained specifically in social reintegration, the period of their training, and whether these trainings were done locally or externally? Also, this initiative, according to this initiative from your ministry, how many prisoners have benefited?
Honorable Minister.
Mr. Chair, I'm not sure as to the thrust of the question. In relation to the overall vision and mission and changes in our transition that we're going through, we're talking about increasing the peace in Guyana. And that in total represents a full engagement at all levels in the ministry and in the forces. In respect of the prisons, recently, we had what we call a Fresh Start project, which we have introduced and has been launched, where prisoners are being trained, educated, and given the tools of the trade for when they exit the prison, so that their reintegration into society would be better. They would have the ability to earn an income. They would not be left adrift and disdained, and would, of course, earn an income and be useful both for themselves and their family, and don't create any harm for the community or their families, or themselves too.
Thank you, Minister. Honorable Member.
Minister,
Honorable Leader of the Opposition.
Minister, it would be assumed that there is a concept paper vis-a-vis this issue. Could you tell us, based on that, what do you perceive to be the requisite skills needed to reintegrate people into society?
Honorable Minister.
We are, thank you, Mr. Chair and honorable member, we are, as I may have said before in the Parliament, we are building a new prison complex at Lusignan. At this new prison complex, the prison headquarters will be relocated to Lusignan. A prison school is being built, a school for the make up the training, the education they might have missed at various levels, coming up to whatever standard they are at. There will be trade shops at a vocational center for training in various skills for training, so that when they leave, they would sew mechanics, electrical, furniture making, animal husbandry. We want to be big in that because we want them to use the opportunity for getting into planting and other things. And I want to thank the Honorable Minister Zulfikar for giving us some of the introductory material, shade houses and other things, to get them more involved in doing things with their hands and to move their focus away from other things which sometimes happens in the prison system.
Thank you,
Mr.
Honorable Minister. Honorable.
I asked a specific question. If you look at countries like Finland, etc., that have these programs, there are certain skills that are needed. For instance, let me give you one example. Apart from psychologists, what are the other skills you see as requisite and needed to effectively achieve your objectives?
Yes, I
Honorable
think this is
Minister.
maybe under another program, but we have a psychologist already. We have welfare officers who are trained along that line in respect of welfare issues, not only for the prisoners, but also for the prison officers. And we are working hard at expanding the types of training and information and reformatting the way we intervene in respect of these issues. I think recently, in respect of prisoners, we released 10 persons under what we call the Fresh Start Project, where they were trained in specific work disciplines, skill sets, and given tools and leaving the prison to reintegrate. But yes, this is a new thing for us, but we're working hard at it. Our strategic management department created a format, an introductory format, and we're rolling this out in this year.
Thank you, Minister. Honorable Leader of the Opposition.
Mr. Chairman, I assume that something like this has a concept paper. Is the minister prepared to lay in this parliament the document that outlines the clear objectives, the stated outcomes, so that we can view it and have a mechanism by which we judge the efficacy of it?
Honorable Minister.
Thank you, Mr. Chair and Honorable Member. We will lay it over.
Thank you, Minister. Honorable Member, Ms. Geeta Chandan Edmond.
Great. Thank you, sir. Minister, according to your indicators in your performance statement, 29 visits are targeted for this year by the parole board. However, there were 0 visits for last year. Could you indicate why no such visits were done for last year? I'm fully aware that visits were suspended due to COVID. However, we have been back to normalcy now. Additionally, can you indicate the status of the parole board? I've been informed that the new board was appointed in 2020 and the life period was 1 year, which means the board has come to an end.
Honorable Minister.
Thank you. In relation to the parole board, the visits, well, you did give an answer to the first part, COVID. And then in respect of the movement of prisoners, there was not an opportunity properly to keep full meetings during the time. We had a resignation of the chairman of the parole board, and there will be reappointments made shortly.
Thank you, Minister. Honorable Member, Ms. Geeta Chandan Edmond.
Thank you, sir. Minister, I'm not sure if you've answered the question on the status of the parole board. Is it operational? Is it functional? Like I said, I've been informed that the new board was reconstituted in November of 2020, and it was constituted for a term of 1 year, which expired in 2021.
Honorable Minister.
Thank you, Mr. Chairman and honorable members. The parole board is functional and it had a meeting last week.
Thank you. Honorable Member Geeta Chandan Edmond.
The minister is saying that the board is functional. That means that the current board the life was extended. If it has been extended, can you provide the date of the gazetted order and the composition of the current board?
Honorable Minister, before you answer, I need to remind members that we have to ask questions pertaining to the allocation. I have been allowing some flexibility, but now we're going into matters which should have been taken care of during the general debate. A question could have been framed: does this allocation have enough money so that it wouldn't hamper the work of the newly constituted board? Go ahead, Honorable Minister.
Mr. Speaker.
Honorable Minister, I've given the floor to Honorable Minister. Go ahead.
Thank you, Mr. Chairman. We will give the information on the members of the parole board.
Thank you, Minister. Honorable Leader of the Opposition.
Mr. Speaker, I just wanted to comment.
Well, you have to ask a question on a line item.
No.
If you give a comment, I will invite a comment from the other side.
No, I don't have a problem about that.
Okay.
You made a comment and I wanted to clarify.
Go ahead.
You're saying, Mr. Speaker,
Yes.
that it must relate to the line item.
Yes.
But if there is a line item and cost for the board, and you ask if the board exists, doesn't it make it relate? And that is my concern.
The issue was answered and I allowed some, but then when we're asking about past performance of the board and past composition of the board, we've had some entrees into history prior, and we are now trying to be more efficient with our times. Honorable Member, Mr. Ramjatan.
I noticed that there has been a 60 million or a little more than 60 million increase under other 6294. I don't see any explanation in any of the volumes for that. Could you tell us what it is all about? Or
Honorable
disaggregate?
Minister.
Thank you, Mr. Chairman and honorable member. If I give a breakdown of the issues under 6294 order, it relates to increase the peace initiative, 50 million. It relates to top-up payments and operational expenses for the SOKU, some $60 million. Operational expenses and community policing, some $130 million. There's a ministerial task force on trafficking in persons, $50 million. There is monies for the forensic laboratory, and then the juvenile holding center, stipends for the juvenile justice committee, stipends or monies for the firearms board, the ministerial tender board stipend, the general administrations for the new opportunity corps, and further stipends for the tender board evaluators. The strategic management department will accrue $450,000.
Thank you very, very much, Honorable Minister. Honorable Member.
Thanks for that
Mr. Ramjatan.
disaggregation. What I notice in the local organizations, there is a 15.727 million, and under the page 474, 11.2 is going to the Road Safety Council in our local organizations. In view of the very many accidents on the road, vehicular accidents, I noticed that 11.2 has been consistent over the years. Don't you think that they should get some more for some other workshops, and rather than stick only the same number, 11.2 million?
Honorable Minister.
Thank you, Mr. Chairman and honorable member. The 11-odd million has not been consistent over the years. It used to be 3 million. That's what we inherited. We increased it to 11-odd million last year. And it is true that this is for road safety, of course. It is true that we need to do more support in respect of road safety issues. We have been working hard on it, particularly after COVID. I may remind honorable members that for the first time in the history of our country, we've reduced road deaths below 100 fatalities for the last 2 years. Below 100. I'm not going to call the numbers but the honorable predecessor. But for the first time in 16 years, even though we have increased cars on the road, and even though we have increased travel miles and persons traversing the roads, We've reduced it and we intend to reduce it further for this year.
Thank you, Minister. Honorable Member, Ms. Geeta Chandan Edmond.
Thank you very much, sir. I refer the minister to 6271 and 6272 telephone and electricity charges. There is an increase of about 5 million and 26 million, respectively. Can the minister provide a brief explanation on these increases? Emphasis is on the word brief.
Mr. Chairman, I think that there may have been some accounts which were not paid, which we inherited. We have acquired new buildings in respect of issues for telephone and electricity uses. They relate to the main office, of course, which has been expanded. The Juvenile Holding Center, the Forensic Laboratory, the Immigration Department, and the NOC for telephone. It also relates to new bandwidth and issues for telephone issues. And for the electricity charges, again, those places in respect of increases.
Thank you, Minister. Honorable Member, Ms. Ferguson.
Thank you very much, Mr. Chair. Mr. Chair, through you, if I can turn our attention to line item 66241, rental of buildings. I note for last year, we had an approved sum of 19.1 and a revised of 10 million. So I note for 2023, the ministry is now requesting some 24 million. Can the honorable member provide us with the locations of these buildings? That's one. And two, provide us with the disaggregated amount for each building that is being rented. Thank you.
Thank you very much, Honorable Minister.
Thank you, Mr. Chair and honorable member. The increase in rentals caters for the rental buildings to house victims of trafficking in persons unit on Hatfield Street. There are monies for the ministerial advisor rental. There are monies related to the immigration support services and various other rentals in relation to the work of the ministry.
Thank you, Honorable Minister. Honorable Member, Ms. Ferguson.
Thank you very much, sir. The honorable member failed to provide the disaggregated amount, which represents the total of 29 million and change for the areas that we have just shared with the honorable house.
Honorable Member, Honorable Minister, I don't know if you feel, but you haven't provided yet.
Mr. Chairman and honorable member, rental of building for the advisor to the minister, 1.8 million. Rental for the immigration department, which has expanded, 4.8 million. Rental for the juvenile justice and the tips department, 9.48 million. Or 8.4 million, and then 9.5 million for rental bills to house victims in trafficking in persons.
Thank you, Minister. Honorable members, I now put a question.
Mr. Chairman.
Honorable Member, Mr. Mahipol.
Thank you, sir. Sir, may I ask for some guidance from the Honorable Minister pertaining to line item total wages and salaries 6116. Does this line item cater for the advisor to the Minister of Home Affairs?
Honorable Minister.
Yes, Mr. Chair and honorable member. I think I indicated this before.
Thank you, sir. Sir, can the Honorable Minister provide to this Honorable House the remuneration package for the advisor to the Minister of Home Affairs in terms of his salary and other benefits?
Honorable Minister.
Mr. Chairman, I call out the very sums before here. Well, I mean, you might need
When,
some
today?
hydrogen peroxide or something.
Today?
I can call them out again, but we talked
Yes,
about
please
being
do.
brief. And I said, I
Honorable,
repeat,
go ahead.
ministerial advisor, 520,000.
So much?
10,000 duty and 10,000 entertainment. And that's repeating.
Thank you very much, Honorable Minister.
Sir,
Honorable Member,
just
Mr.
one follow-up.
Mahipa.
Thank you. Would the minister please lay over the description of his job, the ministerial advisor, in terms of what is his job description? I just want to confirm, sir, that we are paying that amount of money for someone who's an expert advice, especially with home affairs.
Honorable Minister.
We will, Mr. Chairman and members, lay out a description of his job.
Thank you very much, Honorable Minister. Honorable members, I now put a question that the sum stated for Program 511, Policy Development and Administration, current expenditure stands part of the estimates. Those in favor say aye. Those against say no. Ayes have it. The sum stated now stands part of the estimates. Honorable members, please turn to page 520. And I propose the question that the sum stated for Program 511, Policy Development and Administration, Capital Expenditure, stands part of the estimates. The Honorable Member, Ms. Geeta Chandan Edmond.
Thank you very much, sir. I refer to project code 2609110 that deals with community policing. In February of 2022, the minister is on record stating that we would create 175 new ones. That's in relation to community groups this year. That's in 2022. Can the minister provide an update on the creation of the 175 policing groups? Can you also give us the location of these community groups?
Honorable Minister.
Thank you, Mr. Chairman and honorable members. We did this last year, but I'll do it again. The name of the groups: Region 1, Maruka, Bana, Walaba, Manwarim, Kamwata, Mora, Haimara, Cabra, Waramuri, Rincon, Karaburi, Parakesi, Santa Cruz. Total 11 groups for 243. These are the new ones. These are the new ones, ma'am. These are the new ones. I could lay them all over. Well, I lay them over.
Thank you very much,
because I have
Minister.
several pages of the new ones.
Thank you. Honorable members. Honorable Member, Ms. Geeta Chandan Edmond.
Thank you very much, sir. In relation to the provision of equipment and furniture, I'm more interested in the equipment, not the furniture. I don't want to hear about the cabinets, the fridge, etc. This is in relation to project code 2608200.
Honorable Minister.
Thank you, Mr. Chairman and honorable members. I just want to suggest for a few additions. All of the equipment, except for new changes, is what we inherited. But if you want it by department, no, let me just call them out. So for the IT department, UPSs, laptops for batch printing materials, managed switches, air conditioned units for the admin department. Of course, you don't want to hear about chairs and so on. Expansion of the telephone system, 2 million for that. A scanner, shredders. I've got 2 pages of it. Immigration support services, desktop computer, filing cabinets, money counting machines, balance of payment for equipment and furniture, microcentrifuge. Mr. Speaker, the honorable member asked for the information. She said she didn't want to hear about the furniture.
Honorable Minister, you're doing a great job. I heard what she asked. And
I'm trying to answer.
anything else in the form of a heckle, I don't hear.
Yes. Solid phase extractor, camera for very pure vistas, ultra pure water system, Canon advanced printer, UV camera and lamp, Vortex mixer mini, server IT, long range walkie-talkie, fire pump, CTV system, and so on.
Thank you very much, Honorable Minister. Honorable Member, Ms. Gita Chandan Edmond. Honorable members, I now put the question that the sum stated for Program 511, Policy Development and Administration Capital Expenditure, stands part of the estimates. Those in favor say aye. Those against say no. Ayes have it, the sum stated now stands part of the estimates. Honorable members, let us turn to pages 262 and 263. And I propose a question that the sum stated for Program 512, Guyana Police Force, current expenditure stands part of the estimates. The Honorable Member, Ms. Gita Chandan Edmond.
Thank you very much, sir. I refer the Honorable Minister to line item 6302 that deals with training. There's an allocation of 140 million. And I am on record stating that this is commendable wherever there is an investment in human personnel. I'll have absolutely no hesitation in supporting. The minister in his budget presentation said that crime is a serious problem. We are embracing a more emphatic approach and will adopt more less lethal efforts. This again is very commendable. Can the minister indicate the number of officers that will be trained in embracing this emphatic approach, the specific departments that will benefit, and the spread across the country? Will these trainings be conducted locally, internationally? Will you also be partnering with international human rights bodies to assist you?
Honorable Minister.
Thank you, Mr. Chairman, and the honored member. I want to thank her for her question. I want to correct the article you're probably reading from. I said empathetic, not emphatic. Empathetic. Empathetic. Yes. Empathetic. And with respect to training, I'm glad that the honorable member supports our interventions in respect of providing more training and career development and skills for the Guyana Police Force. I could briefly call out some of the training interventions. There's initial training for special constables, conversion courses for special constables, of course, recruit training, and these are at the various police colleges, both in Georgetown, but also in Berbice and Essequibo. For the CID at Nations Incorporated, CID introduction courses, drill instructor courses, computer training, for Portuguese courses, domestic violence and child abuse trainers, forensic video analysis, immigration training, cybersecurity training, SOCO special training, of course, ICIS and crime intelligence training, certifying officers course, station sergeants and management courses. And I would say there's a conference going on right now in respect to the middle management of the police force over the next 2-3 days. Elementary prosecutors course for newly promoted subordinate officers, junior officers course, skill at arms training, public order and anti-crime tactical training, traffic seminars, radio communication, voice procedures, social intervention community network, disciplinary procedures seminars, trafficking and persons training, MS Office for the police professionals in the admin, Human Resource Management at IDC, Occupational Health and Safety IDCA, Basic English IDCA, Budget Preparation IDCA, Critical Thinking, Ethics and the Police Officer Training, Team Policing, Stress Management, Conflict and Situation Analysis, Community Relations, Audit Training for Financial and Material Systems, Professional Certificate Programs at Texila, Prosecutor's Course at Nations Incorporated, CPR and First Aid Training multi-year courses, Safety and Security Management Diploma at the University of Guyana, Diploma in Cyber Security, University of Guyana. And total $139 million in training.
Thank you very much, Honorable Minister. Honorable Member, Ms. Geeta Chandan Edmund.
Thank you very much, sir. Could you indicate, Minister, how many of your ranks will be trained on the provisions of the Motor Vehicle and Traffic Act, more specifically as it relates to the categories of vehicles authorized to use flashing lights and siren? And we will all agree that this is a sore and perennial problem. And I'm sure you would want to have this situation rectified. Can you also confirm whether or not you intend to bring any sort of legislation, regulation to exempt ministers of government from this category? Because clearly they are in breach of this regulation.
Honorable Minister.
Thank you, Mr.
Very
Chair.
emphatic.
And Honorable Member for the question. Over 1,000 traffic officers will be trained in respect of issues for certifying in respect of traffic. And on the question of lights, it has become unfortunate that through some stores in the city and other places which we are working at, that police type lights are available for sale and people put them up and misuse them. There are a few situations for senior officials and also for diplomats where we have to have reciprocity in relation to the use of lights for emergency purposes and to be able to get to situations which require meetings or to respond to emergency situations.
Thank you, Honorable Minister.
Mr. Chairman,
Honorable Leader
the
of the
minister
Opposition.
referred to reciprocity. Could he tell us the countries with which he is reciprocating with?
Honorable Minister.
Mr. Chairman, basically all members of the diplomatic corps at that top level are required to have a light both on the vehicle of the ambassador or the high commissioner and perhaps on an escort vehicle. We have to tweak the legislation to take account of the changed situations. We have more traffic on the road and people can't get to where they want in time or when there's a situation, but we have to deal with that issue.
Thank you very much, Honorable Minister.
Chairman,
Honorable Leader of the Opposition, I know you're anxious, but I have to acknowledge the Minister's response and then recognize you. You're on the floor now.
Mr. Chairman, the minister said they were reciprocating. That presupposes that a number of countries asked them and they are reciprocating. If the minister says that, then he should be able to say to us, which are the countries that requested and they are reciprocating. To tell us all the countries wouldn't help us. And for instance, there are embassies I see moving around without lights.
Honorable Minister.
Mr. Chair, I said that we reciprocate. It is necessary. It is important for the security and safety of the diplomats and the high plenipotentiaries to our country. Those ones which have lights are the ones which requested. And those ones which don't use the lights are not using it. that we have to do things sometimes as on the floor to make sure that people are safe, particularly high plenipotentiaries to this country.
Thank you very much, Honorable Minister. Honorable Leader of the Opposition.
Mr. Chairman, I accept the explanation, but could the Honorable Minister say to me, in terms of reciprocation, if our ambassador in the United States and Canada have that same...
Honorable Minister.
I'll request of the Foreign Minister for that information.
Thank you very much, Honorable Minister. Honorable Member, Ms. Gita Chandan Edmond.
Thank you. Minister, in relation to tweaking the legislation, would this cater for your colleagues and other persons? And I'm asking this specifically because I'm a daily road user and it is a sore problem for me. I'm on the way dropping my children to school and there's absolutely no emergency. And these vehicles just put on their flashing lights and push you off the road.
Honorable Member, I might have to use a light now to get us back on track. But this matter has been raised a number of times during the debate and here. And there's a standing order with respect to repetition. So we've actually heard from you. And so at this time, please ask your next question pertaining to the head directly.
Sir, with due respect, it's a follow-up based on the minister's response that the legislation will be tweaked. So my question specifically is, will the legislation be tweaked to accommodate the minister and government ministers, and when?
Honorable Minister.
Thank you, Mr. Chairman, and thank the Honourable Member for her question. I want to regret if it appears as though that this is a personal issue for the Honourable Member. But, Mr. Chairman, yes, the legislation will be tweaked to accommodate the appropriate users of the lights and water.
Mr. Speaker.
Thank you very much, Minister. Honorable Leader of the Opposition.
Mr. Speaker, I wish to turn to page, this is 227 of volume 2, where the indicators are. It is stated here, Mr. Speaker, under percentage of cases lost due to poor evidence provided by the police force, in 2022, it was 44%. Now, you set yourself a target of bringing it down to 1.9%. Could the Honorable Minister tell us what are the measures that will be taken that in 1 year will bring this down from 44% to 1.96%?
Honorable Minister.
Mr. Chairman, thank you, and Honourable Member. My understanding is that it was reduced by 19% last year. If indeed it says 1.9, it would simply be an impossibility and maybe an error or a misread of the statistic.
Thank you, Minister. Honourable Leader of the Opposition.
Mr. Chairman, let's assume it's 19. It's still a large gap. The Honourable Minister still needs to tell us what are the measures that they will take to bring it from 44. I'm even willing to give you 25%, not 19. What are the measures you will take to bring it down?
Honourable Minister.
Mr. Chairman and honourable members, I read a detailed list of the training which will be imparted to our Guyana Police Force. The Guyana Police Force is what we inherited. We inherited a Guyana Police Force. And I may say in this place, I will say in this place that the efficiency, loyalty, and professionalism of the Guyana Police Force was in question at a particular time. In question. Now that we have removed that doubt, we can talk about improvements We talked about the reduction in traffic fatalities. I said on the floor in this house that we have reduced serious crime in Guyana of an order of 20%, 2 years in succession. And we will reduce it further this year, which is why we have an increase in budget, and which is why even now as we speak, we have training going along for the middle management of the Guyana Police Force, and we just talked about $130 million simply for training of the officers. I spoke yesterday at a conference for these policemen, and I reminded them that they are peace officers and that we want to increase the peace in Guyana, that we want to reduce domestic violence, disorderly crime, homicides due to drugs and other issues, and also issues related, as happened perhaps yesterday, related to drug smuggling and drug running. Thank you, Mr. Chairman.
Thank you very much, Honorable Minister. Honorable Member, Leader of the Opposition.
Mr. Speaker, I enjoy the penchant for going in the wrong direction. But Mr. Speaker, the minister said that education and training will be done. Could the Honorable Minister tell this House what are the other factors that contribute to this high loss in case due to prosecution? And how is it the police force and the ministry plan to remedy it?
Honorable Minister.
Mr. Speaker, yes, I will indulge nevertheless. I spoke about the prosecutor's course. I spoke about training for the CID in the listing. The police force can improve and will improve if we focus on their service and protection motto, and if we have identified, of course, and they understand that the empathetic approach, respectful approach to people, to the public who pay them is carried out. And we talk about, we know the problems are poverty, youths in difficult circumstances, and all of those issues, which is why we talk about increasing the peace, treating people better in the thing. Mr. Chairman, I will not speak to any investigation about any member in this House, including Mr. Maipal, the honorable member.
Thank you very much, Honorable Minister. Honorable Deputy Speaker had his hands up for a long time to ask a few questions.
Mr. Chair, I crave your indulgence for a short preface. I want to welcome all the students that are here. I am really happy that they have put some weight on the shoulders of my colleagues on this side and brought some degree of sobriety to them.
The question is, do we have enough money in this estimates to provide lunch?
Yes, Mr. Speaker, I will get to that. And I'm happy to know that their presence here has brought the Honorable Leader of the Opposition to the House. Mr. Speaker, I refer to line item 6264. And I wish to ask the Honorable Minister how much of that sum allocated on that line item is dedicated towards equipment for indigenous communities.
Honorable Minister.
Thank you, Mr. Chair. In respect of monies related to regions which are mostly populated by indigenous persons, Guyanese, we have brought in new ATVs. We have brought new pickups. I think Letam Region 9 got in 2 vehicles a few days ago. And other than that, there is also additional equipment which have been brought in and are being brought in pieces in relation to the community policing groups. In respect of the hinterland regions, Region 1, 2 pickups were recently sent there. Region 7, 3 pickups. Region 8, 2. Region 9, 2 additional. These are additional. And Region 10, 2 new pickups for patrol, along with ATVs and motorcycles.
Honorable Deputy Speaker.
Thank you, Mr. Speaker. It seemed as though I touched a nerve somewhere along the way. A few. Mr. Speaker, in relation to line item 6272, there is a tremendous amount of police presence, and we're grateful for them in many indigenous communities. And I wanted to ask the minister, there are many communities where police stations and outposts are operating and are not being charged electricity charges nor water charges. I'm curious to know if those things have been brought to the minister's attention, and if it has, how much of that sum allocated on that line item has been allocated to cover those expenses in those communities.
Honorable Minister.
Thank you, Mr. Chairman and the Honorable Deputy Chair for the question. Basically, it will cover the payment for electricity bills for all divisions, all stations for the Guyana Police Force, including Zara centers, which we're setting up related to the new police stations. So we will cover our expenses in relation to electricity charges and also the telephone charges.
Thank you, Minister. Honorable Member, Deputy Speaker.
Mr. Speaker, thank you. Let me commend the Honorable Minister for his stewardship in the sector, because I know at one point, Mr. Speaker, and I was a victim of it, that at one point there seemed to have been a drift, and the country would know very specifically when components of the force was being weaponized to subvert the will of the people. In relation to that, Mr. Speaker, I look at line item 6302. And one of the things that I had lamented is the lack of diversification in police force. I am therefore asking the Honorable Minister, how much of that allocated sum is dedicated towards recruitment, training, or scholarships in indigenous communities? And we know that sometimes they have difficulty accessing those services.
Honorable Minister.
Thank you, Mr. Chairman, and thank you, Honorable Member. We have identified, honorable members, diversity as a core issue of the Guyana Police Force, among some other services. As a core issue, we recognize that if police go to certain communities, they should have an understanding of the communities which they are providing service and protection to, that there should be a better engagement between the policemen and the persons of the community. And even if they go to an indigenous community, they should learn a few words of the languages of the people, whether it's Patamona, Wapishana, or any other language. But I am pleased to say that we have just graduated 37 new recruits, graduates, to the police force, mostly from Region 9. Yes, indigenous. And we will expand this issue. We will expand this service because we are better secured when we respect each other more and when we like or even love each other more and our various cultures and we understand it better.
Honorable Leader of the Opposition.
Mr. Chairman, I return to page 227 for the indicators. At indicator 3, it said percentage of crime solved with the assistance of the public, 2.83. First, could the Honorable Minister tell us, based on their analysis, what were the problems they had that caused them to have so low public participation? And the second question here is, Having recognized that it is so low, you now put it to increase to 18.15. Could the Honorable Minister outline the strategic actions that will be taken to achieve this objective?
And honorably the opposition.
Thank you. I want to thank the honorable
Honorable
member
Minister,
for. Sorry, yes, thank
I
you,
was
sir.
just advising the honorable leader of the opposition would link that to the line item. Maybe it's other, I don't know. Go ahead, honorable.
6302. Mr. Chairman and other members, we keep saying and we keep pointing out that the poor engagement between the people and the police has a lot to do with the way the police force still carries on colonial structures in the relation they relate to people. Still colonial structures. And I'm not going to say what has happened in the police force when I said that there was an issue in doubt in this country 2 years ago, 2 years and some months ago. The mistrust that there is will be overcome by what we talk about transformative policing, collaborative policing, where we are having youth groups being set up at police stations and also with the community policing groups, and where we have the police to have better engagements to get actionable intelligence from the communities. In many instances, because the communities are small, people are afraid to speak out because they are usually threatened, verbally, abusive. We saw some of that yesterday. Threats of attacks, sometimes threats to burn down the house and to kill you. I did say that a lot of our problems are disorderly, and I say again, we have gone through a period where things fell down, and we're fixing it now. And I want to request of the opposition, particularly its honorable leader, to engage with us on this issue, because the distance, the disdain, the problem with policing has to do when the police are attacked, physically and by political operatives. Physically and by political. They are criticized and critiqued at every level. And I'm not a denizen of the social media, but I see a lot of it. But we need to have, if we want to increase the peace in Guyana, we have to have better respect and engagement on the core issues. We can only have, Madam, Mr. Chairman, I said here before, we had a situation before where an honorable member of this house was chasing people with a cutlass in a village. And Mr. Chairman, I am saying the quality of our discourse, not only in the house, but in social media and in the spit press, is what puts us all at risk. And it is our responsibility on both sides of the house to meet at a position where we recognize that peace has to be guaranteed by the peacemakers who are the policemen, who the guarantors of peace, the peace officers, and that there will be no progress or even prosperity if we continue along the line where we attack each other in a negative, virulent way. And I am asking for the help of the opposition in respect of that.
Thank you very much, Honorable Minister, Honorable Leader of the Opposition.
Mr. Speaker, may I say in passant that peace goes with justice, but that apart. The minister puts the problem in our colonial era, but he hasn't solved any of the colonial era problems. but telling us he's going to reduce it. Could the Honorable Minister tell us how and what strategies he will use? That is the question.
Honorable Minister.
Comrade Speaker,
Honorable Member Mr. Jones.
Thank you, sir. Comrade Speaker, I crave your indulgence. The Honorable Minister made reference, which is the second occasion in which a government member made reference to an opposition member chasing someone with a cutlass. The member has since written.
Honorable Member Mr. Jones. Honorable Member Mr. Jones. I'll check the transcript. The honorable minister said a member of this house. So I didn't know he said opposition. He said house. Okay, honorable minister, please.
Mr. Chairman, the honorable leader of the opposition said peace comes with justice. And fundamental to everything that we do, both here and in relation to our engagements with our people and our political aspirations and wishes, is the question of our democracy. And if our democracy was being undermined here, and we had to fix it here in this building here too, that is the fundamental question of justice. The country demanded justice when our democracy was being undermined.
Thank you.
And that is where justice in this country, according to the Constitution, has to be afforded to each and every citizen, regardless of race, religion, ethnicity, and everything.
Thank you, Honorable Minister. Honorable members, we have now exhausted the time. Honorable members, we have now exhausted the time.
But he hasn't answered the question that I asked.
Honorable members, we have now exhausted the time for this particular agency, and I will now have to put all of the heads that are remaining. Honorable members, I now put the question that the sums stated for program 512 Guyana Police Force current, the sum stated for program 512 Guyana Police Force capital, the sum stated for program 513 Guyana Prison Service current, the sum stated for program 513 Guyana Prison Service capital, the sum stated for program 515 the Guyana Fire Service current, the sum stated for program 515 the Guyana Fire Service capital, the sum stated for program 516 General Register Office current, the sum stated for program 516 General Register Office capital, the sum stated for program 517 Customs and Narcotics current, the sum stated for program 517 Customs Anti-Narcotics capital. All these sums stated I now put. Yes, honorable members, we have all of these heads that I'm putting, and I now put all those programs that I've mentioned to you, and I ask that these sums now stand part of the estimates. Those in favor say aye. Those against say no. Ayes have it. The sum stated now stands part of the estimates. Honorable members, let on your behalf and on my own thank the Honorable Minister and his staff for taking us through the estimates. Honorable members, the House will now resume. And honorable members, before we suspend for lunch, thank you for the greetings, but still remember we are in the House. Before we break for lunch, I had generously given the honorable member, Ms. Annette Ferguson, an opportunity to address the House without prior seeking leave of the Speaker. And I saw she did, as acknowledged, went to social media. But I have a problem with criticisms of the Speaker in the media. And one of the problems she failed to do was to say in her article the generosity of the Speaker with allowing us to speak out of order. Honorable members, and I think she will have an opportunity to correct that. Honorable members, let us break for lunch and be back in 1 hour.
We are a peaceful people, struggle is we struggle, and we don't look for trouble, just ask around. But when outside faces from foreign places talk about taking over, we are a peaceful people, struggle is we struggle, and we don't look for trouble, just ask around. But when outside faces from foreign places talk about taking over, we ain't backing down. We ain't giving up no mountains, we ain't giving up no tree, we ain't giving up no river that belongs to we. Not one blue sake, not one rice grain, not one caress, not a blade of grass. This land is all I know. We gonna make it somehow. We will bend like a bow and never break. Our fathers came here and they lived and died here, and we ain't moving nowhere, make no mistake. Cause we ain't giving up no mountain, we ain't giving up no tree, we ain't giving up no river that belongs to we. Not one blue sake, not one rice grain, not one caress, not a blade of grass. We love the open country of the Rupununi and the Essequibo, daytime or night. Though we may criticize it, this is our home, we love it, and we need to keep it, we have that right. So we ain't giving up no mountain, we ain't giving up no tree, we ain't giving up no river that belongs to we. Not one blue sake, not one rice grain, not one caress, not a blade of grass. So we ain't giving up no mountains, we ain't giving up no tree, We ain't giving up no river that belongs to we. Not one blue sake, not one rice grain, not one chorus, not a blade of grass.